Sandra Burton, and I'm here today to talk to you about how to deliver culturally competent care. We'll be talking about the care for the African American patients and cultural awareness. To be cultural aware involves a self-examination and in-depth exploration of one's culture and professional background. Can cultural competence be mastered? The answer is no, it cannot be mastered. Development of cultural competence is an ongoing process that continues throughout a nurse's career. Based on Campanile-Baycott in 2008, a model of cultural competency, which had 5 components, was created. Number 1 being the cultural awareness, cultural knowledge, cultural skill, cultural encounter, and cultural desire. Cultural awareness is a self-examination and an in-depth exploration of one's cultural and professional background, identification of bias and possible prejudice when working with specific groups of clients. When looking at cultural awareness, one must explore their own cultural and professional background. We need to be aware of any biases and we must deal with them. Most African Americans speak English. One bias area that some have is the African American dialect. They are viewed as being uneducated, which leads to professional beliefs and biases of the African Americans. This often leads to misdiagnosis that goes untreated. Oftentimes, these patients are labeled as non-compliant. When we look at number 2, we look at cultural knowledge. The cultural knowledge is your process of seeking and obtaining educational knowledge base about the African Americans. Each and every culture is made differently. What works for one doesn't work for the next. We must become knowledgeable about the African American culture. African Americans have an excessive burden of diseases and are greater risk when they are low income, lack of health care, and they live in stressful life conditions. One of the health issues they have is hypertension. It is the greatest risk factor of cardiovascular diseases and heart attacks in the African Americans. Higher mortality rates than Caucasians. Hypertension is more resistant treatment and it begins at a younger age. Hypertension leads to consequences of end organ failure. African Americans also suffer from other genetic conditions. Sickle cell is one that they suffer from. This disease affects 1 in every 500 African Americans. And then they have glucose 6-phosphate dehydrogenase deficiency, which interferes with their glucose metabolism. African Americans respond differently to drug therapies. This is seen in the cardiovascular drugs, hypertension agents, immunosuppressives, and psychotropic drugs. They metabolize them differently than others, and they require higher doses. Cultural skill. Cultural skill is the ability to collect relevant cultural data regarding the patient's presenting problem as well as accurately perform a culturally based physical assessment in a culturally sensitive manner. Our goal is to explore the patient's explanations of his or her illnesses. And we need to ask open-ended questions in enlisting details from the patient. Some examples are, what do you call your problem? What do you think caused the problem? What do you think started it? What kind of treatment do you think should occur? Next on the list is the cultural encounters. Cultural encounters is the deliberate seeking of face-to-face interactions with African American patients. Cultural encounters should be a mindful intercultural communication rather than mindless stereotyping. When addressing the African American, it is good to show respect by using their surnames as Mr. or Ms. Riz, or if they're a physician, call them doctor. African Americans' voices are usually louder, so one should not think that this is anger, and they shouldn't take it personally. Health literacy affects 40% of African Americans and is considered a barrier to receiving optimal health care, according to Joseph Campanave-Cope in 2008. We need to educate, and we need to point them to the options that they have, for not all of them are aware of what is out there that can assist them with their health problems. Next, we move on to the cultural desire, motivation to want to engage in the process of becoming culturally aware, knowledge and skillful, and to seek cultural encounters as opposed to being required to seek such encounters, includes a genuine passion to be open to others, accept and respect the differences, and be willing to learn from others as cultural informants. So we can always enlist our co-workers who are African American that can help us with these issues that we have and things that we don't understand. So the key component, the key to becoming culturally aware of the African American population is to seek opportunities to be a service to them rather than be required to. Each person is a unique human being worthy and deserving of love and care. There is a acronym that we use, and it is called ASK. ASK is ASKED, and we use it. A is for awareness, S is for skill, K is for knowledge, E is for encounter, and D is for desire. So we use these acronyms to help us stay online and to really think about it when we're taking care of African American patients, that we can do the best for these clients. Thank you for coming today.